I think injectables really are one of the cornerstone treatments of your practice.
Absolutely. The core part of my practice is an injectable one. It's just everything else that is built around it.
Absolutely. And I've written about you over the years in the Tatler Surgery Guide as being a fantastic injector, which you absolutely are.
This is a picture of Fliss from probably about 7-8 years ago. But where I actually treated Felicity all those years ago, when we looked at that picture there, is we actually started in her temples. And you didn't even realize that you had to have your temples treated, did you, Fliss? What did you think about when I told you, I'm going to start with your temples?
I thought it was quite scary.
She thought it was quite scary.
It's an area that you just don't assume that you were losing volume in even.
No, but then I think you sort of hear of that peanut head, which I thought I didn't really want.
It's amazing how beautiful women describe themselves as peanut heads, you know. But this is where we see, you know, a little bit of temporal volume loss. People describe it as hollowing, skeletalization if they've been sick. And then all we did was restore that, the outer cheek, the front of the cheek, and the area just underneath that. And we have codes that we call that, taught by one of our mentors, Dr. Maurizio De Maio. And we follow these injectable codes. There is strategy. And then we inject very lightly here. We never want to refill the whole nasolabial fold because we can make patients look quite odd by actually making everything look too perfect and too flawless. And by just augmenting all of these areas, what we see is a rotation of the face up and out. And everyone automatically looks more rested, less tired, more refreshed.
And I think those are really key words because I think the barrier to injectable treatment for a lot of patients is fear of an unnatural result and not looking like themselves.
100%. Our patients just want to look like themselves, maybe just a few years younger, before their children, before the divorce, before the pregnancy, before they started a very, very stressful job, before. We're all talking the past tense, whereas what they want to be aware about is the future. They want to feel good, they want to look great, they want to go into their 40s, 50s, and 60s feeling fantastic, and especially the neck and the jawline. And I'd love you to just hold that picture on the left side of Fliss. So that was from about 8 to 10 years ago, and this is her now. What do you think of her progression? It's pretty amazing, isn't it? To go from strength to strength. So if we can actually consult our patients and say with the correct treatment planning, combination treatments, great lifestyle, and with the right practitioners, you should be able to actually look even better and healthier in a few years' time.
I think that's the role of facial injectables, isn't it?
Icing on the cake. Thank you so much. It's been such a pleasure to treat you. You've done so well. Thank you very much, Cheryl, for looking after her. Yes. And thank you very much, Francesca, for an amazing session.
Thank you, Sherina. Thank you, everyone.